So here is a typical candidate patient for a BBL, or a Brazilian butt lift, which includes liposuction, usually of the entire front and back of the patient's trunk, and transfer of that collected fat to the buttocks and hips regions. Now, once I'm done the entire front liposuction and the entire back, especially focusing on these areas, trying to recreate the waistline, or the cintura, or cinturita, as I'm told, you will see that we usually have anywhere from 2 to 4 liters of fat, 4 liters being the maximum Florida allowed limit at one time of liposuction to work with. It's critical to let that fat sit in its sterile container and separate from the fluid that I injected beforehand, so that I have a concentrated amount of fat to work with. Now, how much fat can be safely transferred and reliably transferred depends on the elasticity of the skin of the hips and buttocks. In many patients, it's just fine, but some patients it's too tight, and other patients the skin is simply too loose. In this case, approximately 11 to 1200 cc's was transferred per side. And you can see that generally I'll put an incision at the top of each buttock, and then between the buttocks there, and sometimes down here at the bottom of the buttock, although I don't often use that. So the rest of the liposuction incisions are here and then at the lower back there. That allows me to get the entire back in the majority of patients. From these incisions, I place the fat between the skin and the muscle, and it's really between the deep skin and the superficial muscle, staying out of any of those muscle layers. And we do that under ultrasound guidance. And it's done from multiple different approaches and multiple different depths in that space, allowing, and if need be, allowing, like a farmer sowing his or her field, with the necessary seeds being placed in all different parts of the field and not just in one place. If they were in one place, very little of the fat would survive, just like very few of the seeds would actually sprout. But spread out in multiple layers, the fat has a chance to get oxygen and nutrients and get rid of its cellular and metabolic wastes in order to have the best chance of survival. I tell patients, if you stay off of the buttocks completely for at least 6 weeks, and then as much as possible for another 6 weeks, so that at 3 months you've done the very best to protect that fat, you'll get to keep 70% of it.